why would we need to use atypical antipsychotics? Atypical antipsychotics have been used, of course, the classic case of using these is in schizophrenia. So we've actually found that schizophrenia by itself, people have a higher risk of getting diabetes, and the causes of this are actually not fully understood. We do know that schizophrenia by itself, because it has a higher risk of diabetes, it may just be due to the fact that people with schizophrenia take less care of themselves. If you actually look over time, you can actually find that some people will weigh more and their diet will be poorer. These simple things could mean that people with schizophrenia are at higher risk of diabetes, or it actually could be something to do with the disease itself. We know without even taking the atypical antipsychotic that these things are true. But on top of that, the atypical antipsychotic can actually worsen all the underlying things that are already there. Atypical antipsychotics actually seem to cause problems with cholesterol. They can increase triglycerides. They've actually been shown, as I've mentioned before, to worsen insulin resistance, and they can actually tip people over into diabetes. So how to manage this is actually something that is still not completely known. These atypical antipsychotics tend to be, in some ways, better for the person with schizophrenia than the typical antipsychotics because of a side effect profile. The typical antipsychotics are the old ones that people are more familiar with, such as Haldol. Long-term can have very bad side effects. And so the atypical antipsychotics have a different profile. This profile metabolically for you may not be great. It may increase weight, it may increase triglycerides, it may increase your risk of diabetes, but it also may help to control the symptoms of this crippling disease called schizophrenia. The other place that it actually is used quite a bit is in atypical depression. So many people who actually are on a depression medication may not be getting a full response, and that's going to have to be determined by a healthcare professional whether they think you're actually getting a full response from the antidepressant medication you're on. Because many of you listening actually have diabetes, we know that diabetes is a very common comorbidity depression is a very common comorbidity with diabetes. And so if you're on an antidepressant and it's not quite helping all the different symptoms, many doctors now will add a little bit of an atypical antipsychotic. Can that cause the same problems I've just mentioned? Absolutely. It can worsen insulin resistance. It may actually worsen your diabetes. So be aware of that and talk to your healthcare professional about what you're going to do if your sugars start to go out of control on the atypical antipsychotic.